and welcome to Sharpscratch. I'm your host, Zaynah Khan. I'm a medical student at King's College London, and this year I'm taking on the role of editorial scholar from George, who you might have listened to previously. Today, I'm bringing back one of my favourite episodes from the archives, Is There Room for Creativity in Medicine, by one of my predecessors, Ava. I've chosen this because I was quite conflicted when I was younger, deciding whether I wanted to go into medicine or the humanities. But what I've come to realise now is that there's a lot of humanity in medicine and creativity too. There's scope for art within your professional career, and I don't want to lose that. And I think this episode helped remind me of that. I hope you're able to enjoy it and find it as refreshing as I did. And over to Ava now.
Hello and welcome back to Sharpscratch. You are listening to episode 115. Is there room for creativity in medicine? This is a podcast brought to you by the BMJ, where medical students, junior doctors and expert guests come together to discuss all the things that you need to know to be a good doctor, but that you might not get taught at medical school. I'm Eva, and I'm a medical student at Lancaster University, taking some time out of my studies between my third and fourth years. This year, I'm working as the editorial scholar at the BMJ, looking after all the content BMJ students are producing. I would like to welcome back our panellists, Nikki and Anna. Would you like to introduce yourselves?
Yeah, of course. I'm absolutely delighted to be back again. Much as I keep saying that I'm going to retire from Sharpscratch because I'm not junior enough anymore, but here I still am. But really happy to be here. My name's Anna. I am an ST1 academic clinical fellow in obstetrics and gynecology, and I work up in Newcastle in the northeast of England.
And hi everyone, I'm also really excited to be back. I'm Nikki, and I'm in my last 2 weeks now, I think, of being a final year medical student at the University of Manchester, and I'm soon to be an academic foundation doctor in the southeast of England.
So excited to have you both back, both former Sharpscratch hosts as well. So amazing. So often we think of medicine as a science, we think of doctors as scientists and scholars. We pride ourselves in being, quote, women in STEM, supporting evidence-based medicine and learning the so-called medical model. Our view of medicine, its teaching and its assessment is often framed by medical science, and we might not think of ourselves as creatives. So in this episode, I thought we could discuss whether there is room for creativity in this world of medicine. We'll hear from some creatives in medicine and how their art has contributed to their practice and their careers, and we will think a little bit about the creativity hidden within the medical curriculum. So just to kind of start us off, I asked a few, experts if there is room for creativity in medicine. So this is Roshni Bihari. She is a medical educator, a former NHS consultant. She's a writer and a poet, and is also the writing for wellbeing and personal development facilitator. And here's what she had to say.
As a medical educator and former physician, I feel that creativity is an integral skill that we develop in ourselves as healthcare professionals, and it shouldn't be seen as separate to other skills such as history taking or clinical examination, for example. If we think about what creativity involves, innovation, novel ways of thinking, observational and analytical skills, problem solving, the all-important reflection and reflexivity, all these skills are transferable and vital to what doctors do in patient care, creating new treatments, modifying management plans, creating new teaching and assessments. As well as being a medical educator, I'm a writer and a poet, and love to use writing with others in the professions and students in order for them to rediscover their innate creativity, explore their experiences, thoughts and feelings. I use this myself across my learning journey as a medical student and doctor to now being a medical educator and working with people in other ways. For example, I've written poems, creative non-fiction and short fiction pieces for myself as part of my own reflective journey on a range of things such as patient interactions interactions with colleagues, and teaching experiences, whether they be good, bad, or somewhere in between. That's the point. Creativity is a way that we explore and learn about ourselves as well as others. Being creative in one's approach is how we learn and practice. It's another lens to examine things. Medical curricula and training will always be crammed, with subjects jostling for space with each other. But I firmly believe that there is space for creativity if we as educators, healthcare professionals, students and trainees make the space for it.
So I really loved that reflection from Dr. Roshni Bihari. I really appreciated how she, I guess, made reflective writing fun. I don't know about you guys, but when I have to write reflections for my portfolio or whatever, I don't think of them as particularly creative.
No, that's true. We have to follow perhaps quite a rigid structure in order to get them marked correctly and to tick the right boxes. It feels as though the curriculum is almost putting them into more of a box rather than letting you be more creative with them, because you have to kind of match it to this checklist of things that you have to have in your portfolio.
I think what I really liked about what Roshni was saying, and I have spoken with Roshni before about certain things like this, because like Roshni, I also maintain very much a less active recently because I've been so busy with my clinical work, but I do maintain a practice as an amateur poet, and I've been published in several sort of online literary journals, and I also was lucky enough to be featured in the These Are the Hands NHS poetry anthology a couple of years ago, which allowed me to meet other people who, not just medics, but lots of healthcare professionals who use poetry as part of their reflective practice. And it's interesting to me when I see how much of my poetry does have elements of reflection on things that I have experienced as a junior doctor. And I wrote a poem at the end of my FY1 year, which I found to be really, really cathartic, because it just allowed me to have that space to, in a creative way, sort of summarize what a whirlwind that year can be and how much learning you have. Somebody said that poetry is the best words in the best order, and that also extends to sort of removing superfluous words. So the aim of poetry is to have this really distilled piece of writing that still somehow captures the feelings and the emotions that you're trying to communicate to the reader. And in that process of distilling that year down into that poem, I really came to terms with some of the things that had happened to me. And it was a really important process for me. And it allowed me to, when that poem was published, which I was really lucky that it was published in a Journal of Narrative Medicine, and I got some really lovely comments about it. But that wasn't really why I wrote it. But it serves as a way of me earmarking that time in my life and saying, actually, that part of my life is finished now. It's like being in a bubble, because when you come up for air, you're like, oh my goodness, all of these really life-changing things have happened to me, and I haven't really had a chance to think about that. But writing that poem was that for me. And I think I really liked what Roshni said about finding space for creativity in the nooks and crannies of the curriculum. I'm not saying that everyone needs to take a poetry class as part of their medical degree, because that takes some of the joy out of it. And as we know, you've got to learn so much stuff in medical school, but it's about all of those things that you learn anyway that have a creative element to them that you might want to just have a think about. And I think clinical practice in particular, I don't know, Nikki, as you come towards the end of your medical school journey, that sort of the clinical reasoning and diagnostic reasoning, I think there's a real creative element to that.
I've always said that I think that medicine is more of an art than a science, but it's based in science. So you obviously need to know a certain amount of science. It's based on the evidence. And I was using the analogy, say if you were to think of it as painting, the tools that you're using, the paintbrush and the paint and things, are the evidence of the science. But actually being a doctor or practicing medicine is a creative art, I would say, because it's difficult because we're taught in such a scientific way, which I think Roshni was talking about, and we're taught by this kind of pattern recognition to apply science and evidence, I guess. But in real life, every single patient is different. You have so many different factors to consider that actually that kind of process of application is quite creative.
I think it's really interesting what you're both saying, but it's nearly like turning the question that we've asked on its head. It's not so much, is there room for creativity in medicine? It's nearly that creativity in medicine makes room for like thinking and gives you the headspace that you need to kind of do your job in practice, especially hearing your reflections on that poem that you had published on it. It seems like that catharsis nearly created room for you. We have another voice note now from Megan Brown, who is a senior research associate in medical education at Newcastle University, near where Anna is, and she's also a recent guest of the podcast. She spoke to us about how curriculums are often designed without this creativity in mind, and how we can make room for creativity when it feels like we can't because of the systems that we're working in.
I think that so much of medical practice is creativity. We don't often acknowledge that, particularly within medical school. I work within medical education, and there often isn't space, there isn't room for creativity within our education and training, because we're very focused on, there is a lot of knowledge to learn. The curriculum is jam-packed, and often the argument I would hear is, if you want that poetry, you want that creative content within the curriculum, what has to go? What can go? Everything that's there is important. And I get that. I really do get that. But I think that there are ways to create room and to create space within a curriculum in that more integrated and spiral way, where we find small opportunities within existing curricula to think about creativity, to promote creativity. And there are just so many areas where creativity and creative thinking is important. I'm thinking about problem solving within diagnosis, connecting symptoms together to diagnose conditions. That's pretty creative to me. I think that's quite amazing and incredible that people can do that. Speaking as someone who doesn't practice clinically anymore, it's an impressive feat. It is a creative feat. I work within medical education research, and there are a lot of clinical academics within research, not just med ed research, but clinical research. And I think, that's incredibly creative. Designing a study, seeing it through, interpreting data is a creative act. And that's interpreting data within a research context, but also, we're all expected to practice in evidence-based ways. You have to be able to make sense of evidence, and that often does require some creativity in terms of how am I going to apply this to practice? How am I going to apply this to the patient that's sat in front of me? I do quite a lot of research on communication skills and empathy, empathetic communication. It does require creativity. You need to be creative in terms of communicating with colleagues, with patients, explaining complex medical information. I know a lot of clinicians will use illustrations and models to explain complex areas of practice, complex diagnoses, complex treatments. And I think that is creative. That does seem creative to me. I think the problem is that we don't really teach any of this, I've been part of some medical schools where we've run sort of creative SSCs, and they've been wonderful. They've been so it sounds cheesy, doesn't it? But they've been really life-giving as an educator. And people are so talented. I'm sure that anyone who's at med school can look around and see, we don't often share those parts of ourselves, but there are amazing artists, musicians, poets, writers. People who are at med school are so talented, really, really talented, but it's finding an outlet for that. And for me, it's been through these SSCs, and that's brilliant, but they tend to be one-offs. Not everyone gets to do them. They're not central to the curriculum, and that sends certain messages about what's important, what's not important, in that case, in terms of creativity being peripheral and not being a central part of what we do. So I think trying to find those small opportunities within med school where maybe it's within a comms skills session and you can think about creative ways of explaining information, or maybe it's about creative ways of, creative thinking when you're thinking about problem solving, or devising treatment strategies, or maybe you're thinking about how you interpret evidence. And I think naming creativity and finding ways to do that is really key, as well as the larger ways of engaging with creativity where, you might be sitting down with some visual art or a poem and thinking about how it might explain or bring you into a certain part of a patient's experience. That's super powerful, but it does require more dedicated time and effort. I think that's important too, but that's a bigger problem. So I think there's definitely room for creativity in medicine in small and large ways, but there are barriers there to achieving that within actual practice.
Now, yeah, me and Megan are like in cahoots. That's how I would describe our relationship. We've got like all these plans for doing it. We just got some funding for a project looking at disabled doctors transitioning from medical school to clinical practice, and we're part of the sort of secondary analysis of that is going to be a poetic inquiry. So we're going to create poetry from the words from the interview transcripts, and then we're going to work with the participants that we're interviewing to create essentially a set of poetry that will form part of the analysis for the project, and hopefully be presented at the end as a way of, I guess, communicating that research in like a really succinct and powerful way. Yeah, it's something that I'm really keen to like continue to incorporate into my research practice as well, like as Megan has said. But I think what's really interesting to pick up on is this idea that there is a lot of hidden creativity in medicine. And I wonder why we are afraid potentially as a profession of being open about that. And when I think about my own practice, I'm an obstetrics and gynecology trainee. One of the things I've been doing this year is learning like the basics of operating. And that is creative. Operating is creative because not everyone looks the same on the inside. Sometimes, there's things that are unexpected and you have to deal with that. And obviously, you know your anatomy and you know what's safe to do. But within that area of safety, when you're operating, you do have to find creative solutions for things because sometimes things are, not exactly where you expect them. And I wonder why we're afraid to say that that is a creative process as well as a scientific one. And I think a lot of it comes from that we're very keen, I think, as medics coming from this like positivist way of thinking to think of ourselves as being objective. And, when you think about like TV shows with doctors, like, I mean, I've never watched Grey's Anatomy, so I can't talk about that. But I know you guys. But like, I was House. Okay, that was my era. I watched House, and everyone's like, oh yeah, it's so cool because he's so detached, and like that's how he's able to, make these connections and this, that, and the other because he doesn't care and he's totally objective. But I think that's a total fallacy.
I agree.
Nobody is objective, and we can't pretend that we are.
Yeah, you need to acknowledge the fact that you're not. Yeah, definitely.
Yeah. So I don't know if that's where some of the nervousness around saying, yes, actually, there's a huge amount of creativity and a huge amount of sort of, I guess, quite personal development that has to be done in order to be able to do these things. And whether that's us admitting that we're not objective, and that's something that's scary for us to do as doctors.
It's so interesting because I was just reflecting during that voice note about how many talented people there are at medical school in terms of when you think about when you're applying to medical school, there are points for kind of instruments that you play or things that you might have done like writing or whatever else. And actually, I think that really drops off throughout medical school, perhaps because of time constraints and going back to the kind of how could we fit anything else into the curriculum that's already so kind of jam-packed. But it is a shame. I still do our like medics orchestra and choir, and it's one of the best things that I do, and it's so nice that we all still have a chance to kind of make music together. And we just recently went on our like choir and orchestra tour. We played in these care homes, and I don't know, I think it's such a shame to lose that creativity, that there's clearly so many really talented people. And I guess reflecting back on that voice note, it's about making the room to apply that to every aspect of the curriculum rather than forcing in an extra module. Because, yeah, I've done SSCPs in narrative medicine. One of my friends has just recently done one about music and medicine, but they're the ones you opt into. They feel very separate to the curriculum. But I think there is something about everything that we do clinically has a creative element to it, rather than making room for it, almost acknowledging what we're already doing and teaching people how to do that or do it better.
I'm really keen to talk a lot more about this, but that will be right after this message. Anyway, back to the show. So I think part of why I think I'm nearly apprehensive to call myself a creative is because I see what you guys are doing, Nikki, with your like orchestra and choir, Anna with all of your poetry is amazing, and I've never been that good at anything creative. I was always encouraged to like pick up musical instruments as a kid, and I was always a very, very keen writer, but I've never fully committed to any kind of creative outlet in the same way that I never committed to any discipline really. And that's how I ended up in medicine, was because I couldn't choose between the humanities. I did 2 essay subjects at A-level, and I couldn't choose between pursuing those and pursuing science, as in like hard science. So I was like, if I do medicine, I can keep the science but apply it to people like in their context. So I think I'm nearly apprehensive to call myself creative because I don't have any real like creative talent in the same way other creatives do. Does that make sense?
Well, I would say firstly, that's not true, because you are a fantastic writer and editor. And I would say that editing is so creative. Like, particularly, I found, when you're having to cut something down, and instead of just, like, you can't just remove words, like, you have to rephrase something, but with less words. Like, that's super creative.
You could even change the complete direction of, like, with the same words, and just by, like, reordering things and moving things around, you change the whole direction or point of a piece. So,
yeah. But the other thing I would say is I think you've picked up on a really important point that I've noticed when I've been doing. So I've recently started tentatively doing some work around exploring creativity a bit more widely, and providing a bit more of a space for people who are interested in using creativity, either as part of their practice or teaching or in their research, to come together. So under the guise of the Association for the Study of Medical Education, there will be a new group formed, which is for people who are interested in using arts and humanities in medical education or medical education research, not just medical education, like any healthcare professions. And something that I have encountered quite a lot when I've been telling people about this is people saying exactly what you just said, but I'm not really creative, like I couldn't do that. And I think it's a huge fallacy, because it's a bit like anything, There are some people who are going to be naturally better at riding a bike, but it doesn't mean that you can't learn to ride a bike. I can't really ride a bike, but I think I could if I put my mind to it. So, it's one of those things where working on it is really, really important. And if it's something that's important to you, and particularly if it's something that you find impacts really positively in your well-being, then it's like putting that time in. Do you know what I mean? And sometimes it's not that enjoyable. Like, I don't know, Nikki, maybe you don't feel this about your choir because it's more community orientated, but I sort of akin it to, I do a lot of running. Not every run I go out and do I enjoy, but I needed to go out and do every run that I've done.
Yeah, well, no,
if that makes sense.
I definitely agree with you. And I played the piano until I was about like 15 or 16, and I didn't really enjoy it at all. I'm not very like a manually dexterous person, so like being able to like move my fingers separately was always which is probably also why I'm awful at art, like painting, drawing. Cannot do it whatsoever. I was the only person in my class to be told that I wasn't allowed to do art GCSE in year 9. So I also didn't think I was very creative for ages. But yeah, I definitely I was carried on playing the piano even though I didn't enjoy it, because I knew that I needed to have like a certain level of like musical knowledge or like background and discipline to be able to sing to a certain level. So I definitely empathize with that. I think there is sometimes work that you need to put in, and you might not enjoy bits of that. But I also think that there are definitely, I would always go as far as to say I think that everyone has a huge amount of creativity, but they perhaps don't recognize some of the things that they do as being creative, and they wouldn't think of themselves as creative or artistic people whatsoever. Like, I would even think of some of my friends or course mates who think very much that they're very science-oriented people, and often people who have turned to me and said, oh, how come you didn't study like literature or philosophy if you like books and reading and things so much? Like, why did you go into medicine if you don't? Not that I don't like science, I definitely do, but it would never have been my favourite subject at school or anything. It was more of a means to an end. And I think it's really interesting that these people who are doctors or like medical students just don't see what they're doing as being creative.
You never hear like the really, really super scientific medics be told like, oh, why didn't you just study biomedical science? Why didn't you just do a physics degree? I think there's some reading into that to do, like.
But it comes back to that diversity of like the workforce, doesn't it? In terms of like, we need people who have got different skills and backgrounds, and that again, it even ties into to an extent like the kind of specialties, like which specialty you're suited to. Like, definitely. I know as someone who's not very manual-dextral, not very good at art or sewing or cutting, I could never be a surgeon. I just know that that's not my personality whatsoever. But so I guess, yeah, the diversity is really needed. It would be a real shame if we were all just good at the same things.
And just to come back to a bit about what you said, both of you have mentioned like drawing and art and stuff. I would also like go so far as to say that I was quite bad at art. So one of the things, me and my best friend from school used to go to an additional art club. And one of the things that we did for weeks and weeks and weeks was we had this huge piece of paper and we made this artwork that was all just pictures of eyes that we cut out of magazines. And we made this huge collage of the eyes. And the art teacher was like beside themselves. They were like, why have you done this? It's horrible. But I really enjoyed it. And I actually recently went to a drawing class with two of my friends who were also like junior doctors in the area. And it was so brilliant because it was like a still life thing. And I was doing all these drawings and I was looking at them and I was like, it doesn't look anything like what I'm trying to draw. Like, it's just so rubbish. But the drawing teacher was like, oh, that's brilliant because you've like really captured this bit and like and all of this. And she saw it in a completely different way. Like, she wasn't looking at whether it looked like, you know, like a photograph of the object. She was like looking at specific like techniques and like the way that you'd done things. And it just really made me think like, it's not necessarily about, you know, being what you think it needs to be. It's about sometimes the process of doing that. And I just had a really nice time, and it was just so out of my comfort zone, but it was really good.
Perhaps actually like the perspective that she had there is what we need to be applying in this kind of conversation in terms of like seeing it in a different way, rather than us all sat here being like, well, I can't draw and I can't sing and I can't. So yeah.
But I think perspective makes such a difference and is also so important in medicine. Do you know what I mean? Like, and we've talked about it quite recently in Sharpscratch. It is the ability to like maybe readjust what you're hoping for, like, because you're not treating blood results or scan results, you're treating people, and it is all about that perspective and being able to like adjust it. And I think creative outlets, even if they're completely unrelated to medicine, like help develop those skills and keep in touch with those skills. So we will talk a little bit more about how we can use creativity in medicine and hear from some more people who have done that. But that will be right after this message. Back to the show. So we've talked quite a lot about our own creative outlets and about creativity in the medical curriculum, and how I nearly feel bad for saying how we can make room for it, but how we can, you know, express our creative sides in a curriculum that doesn't always make it easy to do so. For this last section of the show, I reached out to some doctors who have used creativity in their own careers, just to get an idea of all the different ways that you can do that. We've already heard from Anna, who has used creativity in her med ed work and in her research, and it seems that she's not the only one that's done that. So let's hear from Antonia.
Hi, my name is Dr. Antonia Pylabert-Richardson, and I'm a junior doctor with a special interest in medical education and ophthalmology. So firstly, is there room for creativity in medicine? Well, I say definitely, and I'd even go as far to say that creativity is necessary in medicine, and particularly medical education. When taking on the enormous task of learning about everything that goes right and wrong with a human body and mind, you cannot expect everyone to be able to understand and remember information in the same way. Personally, I know I don't learn well from a black and white textbook or didactic lecture, so when I'm seeing patients, I know my clinical reasoning is helped by having a head that's full of mnemonics, or remembering beautiful anatomical diagrams and memories of communication skills sessions. I have used creativity throughout my career, and particularly in my current role working as an education fellow with the University of Manchester. For example, I teach life drawing classes with artists and models to put anatomy into context. And this is what doctors have been doing for thousands of years. And something else I do in my lessons is I use songs and mnemonics and music to help students with the rote learning elements to medicine, which, as I said, is something I've always found very useful. And one of my favourite things is watching actors, as simulated patients, guide the students with communication skills, drawing upon their own expertise in the performing arts. So, backed with real evidence and theories of learning, and also my own experiences of being a student and now a teacher, I do believe that incorporating art, music and performance into the curriculum makes both the learning and the teaching process more enjoyable and more effective.
That's just made me think about how much an OSCE is a performance. In terms of like, before I go into an OSCE, I do the same things that I used to do before I had a big concert or I was going on stage. So I have like the same kind of ways of like calming myself, or like making sure that you sleep well the day before, because you're just about to go in and perform. And actually, I always find that every time I leave an OSCE station, rarely could I have done better in that station by like revising something more or learning something extra. It's just like how I conducted myself in those 8 minutes, and whether or not I got flustered or went on a tangent or missed the point of things. It's all about how I performed in those 8 minutes, and not about... So when she was talking about the actors and simulated patients, it just made me think, actually, we act as well, because that we know it's not real, but it still makes you really nervous.
I was at a medical education conference like a year ago, and there was a really interesting presentation. So the team at Imperial had offered students who had failed their final OSCE in final year the opportunity to have a set of sessions with an acting coach who had essentially given them techniques to manage things like stage fright. And it was really, really interesting. I think like almost all of the students who went through that course then passed on their second attempt, and they gave really good feedback about like, you know, the techniques that they'd learned to do exactly what you're saying, Nikki, like managing you know, all of the anxiety in the run up to the OSCE.
I fully do like breath work, I do vocal warm-ups, so it just helps me feel like I'm more in control of it.
Yeah. And it's really interesting, isn't it? Because when you think about, you know, people like high performers in other professions, like even like athletes, but musicians, actors, they will have a like set of rituals. And I think it's very much less prevalent, I think, in medicine to have that preparatory support. So that's something that maybe we could learn from like more creative industries as well.
And I think it plays such a huge role in learning for like across very different contexts, from OSCEs to anatomy and probably like a lot of things in between.
Yeah, well, we're all very different like learners, and I think it's, especially at Manchester, we're a huge year group. So I always think it's quite difficult to be teaching kind of 400 people the same thing in the same way, and actually having more techniques that use visual things or sound or whatever else would be so beneficial.
And Prof Gabrielle Finn, who is works at Manchester, does a lot of work around like body paint and drawing for teaching of like anatomy.
Yeah, in our second
workshop.
I think it's our great. First or second year, we all bring a white t-shirt in, and then we all have to like paint on each other for like where different things were.
Yeah, so that hadn't reached King's when I was there. I wish I'd had that.
It was how I learned the triangles of the neck, which I'm still not confident that I know, but it was how I originally learned them, was by drawing all of the triangles.
What you've just reminded me, one of my friends used to sit there in the library in like first and second year before any anatomy exams and like was like drawing all of like the anatomy of the arm up her arm, and then we were all like, you can't go into the exam tomorrow with that, and she was like, oh no, wait. She's like drawn everything all over herself, and then we were like,
Get the nail polish remover out to try and like rub it off. Oh gosh.
So Anna, you touched on like research there, and I guess med-ed research, but also there are other research applications of creativity in medicine. So I spoke to an academic clinical fellow in dermatology about his research into creativity and dermatology.
My name is Dr. Raymond Matthews, and I am the author of scientific papers examining the benefit of using art and music in medical education, namely visual literacy training and music literacy training. Professionally, I am an academic dermatology trainee in Manchester. However, I am also passionate about music. I am a classically trained oboist and have played in multiple symphony orchestras, and I am a keen Irish traditional musician, playing the tin whistle in many cultural settings over the years. Naturally, I wanted to combine my love of medical research and the arts. Visual literacy training teaches doctors how to be better at describing skin problems by using art history concepts. Using non-medical concepts such as shape, line, texture and colour to say what you see helps remove diagnostic bias that more medical descriptive terms can carry. This is particularly helpful when we are unable to make a spotlight diagnosis and need to go back to first principles to consider what the disease process really is. It also allows us to more accurately describe a skin problem to a colleague who may not be able to see it for whatever reason, and thus get their advice. When I was a medical student, I created a mixed methods approach with an emphasis on qualitative research to further our understanding of visual literacy training and to provide support for trainee and consultant dermatologists. I developed music literacy training as a natural progression of the conceptual basis of visual literacy training, using musicology concepts such as pitch, melody, dynamics and rhythm to teach doctors how to make more detailed descriptions of skin problems. We did this using music from a variety of genres, from classical to pop music, and taught junior doctors how to technically describe the music they heard, and also describe the emotions and imagery it evoked within them. We found that by delving into their skills in describing music, we found objective improvement in their description of skin problems. For me, this work has cemented the place of creativity within medicine and in research. Ideas are the most valuable thing that we have in progressing our understanding of the human body and in the care that we develop for our patients. Without creativity in medicine, it is difficult to generate these ideas. And on that point, for creativity to flourish, we must cultivate an environment where creativity is encouraged, whether this is in the clinical or academic environments. For me personally, I would like to thank the academics and consultant dermatologists Dr. Helen Young and Professor Chris Griffiths for fostering and nurturing my own creativity in incorporating the arts into medical education.
I just thought that was pretty cool, as like
That is
So
incredible.
just like bringing together of creativity and like clinical research. Culturally, we see us so diametrically opposed, and yet we've literally seen material benefit.
Because actually reflecting on it, the kind of examinations where you have to describe things, so say like dermatological, like describing skin lesions, or even like a mental state exam where you're describing like patient's appearance, behaviour, we're actually kind of taught a list of things to basically include or exclude. And we're never really taught how to describe what we're seeing. We're just taught like either say this, or then you say this or this, or this. It's like a checklist.
Yeah, and then that goes right back to the pattern recognition, where you could like so easily just bark completely up the wrong tree because like it's an unusual presentation or it's on a different colour of skin or whatever. It's like nearly reinforces so many negative biases.
And you can empathise with why we're taught like that for kind of, again, volume of content, or like making it easier for people to describe quickly, accurately, or not miss bits out. But it is a shame if we're then missing out a whole side of things.
And I think it's not just like describing things that you're sort of seeing, as you kind of touched on, Nikki. It's like in history taking as well, your creativity is interpreting that patient's creativity in the way that they have understood what's happened to them. Because what's important to you is the thing that's important to that person. And you have to listen properly, and then you have to use quite a lot of lateral thinking sometimes to think, okay, so what has actually, you know, brought this person in? What's the next question that I'm going to ask that's going to help me or help us as a, you know, the patient-doctor interaction as a unit to come to a decision, not necessarily a diagnosis, but make a plan that works for everyone. And I think something as simple as that have to be quite creative as well.
I completely agree with you. I think actually history taking, I can't believe it's taken us this long to like come to it properly.
I know, this should have been like the first thing.
Is when after having done my year at the BMJ, when I did part of my elective with Channel 4 News, I was talking a lot about journalism. A lot of people were asking me about how come I'm interested in journalism but also in medicine. And I remember thinking, actually, it's a lot about having the curiosity to ask the right questions and then kind of formulating something from the answers to those questions. So whether that's the story or whether that's the diagnosis, the management plans. And I actually think that history taking, or good history taking, is actually the most creative thing that perhaps we do.
It's like the thing that I get the most joy out of in medicine. It's certainly the thing that makes medicine worth doing for me. Isn't the like sitting down with a textbook. It's the like curiosity about what is going on for patients and what patients do care about, and then figuring out from that what is going on and how do you fix it. That's what is exciting to me as a student. That's
and then making those kind of connections between things that might not feel relevant.
Dr. House, back at it again.
I'm glad you said it and not me, because I was about to. I'm like the least Dr. House person. So we just have one last but not least contribution from the BMJ's own John Lawner.
I did my first degree in English literature, then decided I wanted to be a doctor, trained at the Old Middlesex Hospital in London, and went on to become a GP, but I also trained as a family therapist because I became very interested in helping with the psychological problems of families in the context of general practice. So I suppose my career has been unusual and in a sense creative because I've always been interested in working at the interface between different subjects, literature, medicine, medical humanities, systemic family therapy, how systems work. I was a working GP for nearly 30 years, but I combined it with a number of other strings to my bow as a family therapist. As a writer, I've been writing ever since I was a junior doctor, been writing columns, been writing stuff for myself, all kinds of things. So I've really worked between subjects rather than on subjects. Is there room for creativity in medicine? Yes, absolutely. I think virtually every intelligent doctor I've known, every enthusiastic doctor I've known has done something else, whether it's music, painting, writing, whatever. In fact, I think it's a tremendous source of energy, and it gives you a completely different perspective on everything you do within medicine. So I'd be quite concerned and I think quite sad about doctors who did nothing except medicine and didn't do anything creative in the arts or in other area, maybe in outdoors activities, but in some way saw their lives as far more about medicine itself. The other question you asked me to address is, how have I used creativity throughout my career? Well, apart from my writing, my interest has mainly been in training people in interactional skills, so what used to be called communication skills, interactional skills for working with patients, working with colleagues, working with teams, and particularly in an approach that's called Conversations Inviting Change, that is based on ideas from narrative medicine, which is really about improvising the conversations that you have with people, listening to their stories, listening in particular to patient stories, and asking questions not in a standard way like taking medical history, but in a way that's genuinely curious and weaves in and out of what I call the narrative and the normative, the story and the normative stuff that doctors are meant to think about. So you're getting a picture of somebody which is both about the medical facts that you need to know about them in order to treat them well, but also the story of their lives, so that your understanding of them is wider than their pathology, and the help that you can offer goes wider than the obvious things of a prescription or a referral or something like that. And I see that as probably one of the most creative things that I've been involved in over the course of my career.
That was just such a lovely summary
Aww,
of all we've been
that.
talking about.
I love that, the narrative and the normative.
Yeah, I hadn't heard that kind of distinction between the two until then. It nearly points back to what we were saying earlier about how there is a role and a place for both, and both are very important.
I think that was a really lovely clip to end on.
Good summary of what we've been reflecting on.
So that is all that we've got time for today. Thank you so much, both of you, for joining us, and thank you to everyone at home for listening to this episode of Sharpscratch. If you like our show, I would love it if you could support us by leaving a review wherever you get your podcasts, or by sharing it with the people that you know. Tell your friends about it. That really helps people to find the show. Please do keep in touch as well. I would love to hear your thoughts on the show, especially any creative outlets you found or ways of bringing creativity into your experience of medicine. You can find us on social media. We are BMJ Student on Twitter, X or Instagram. If you would like to hear other episodes, please do subscribe to Sharpscratch wherever you get your podcasts, and in 2 weeks' time you will be notified of our next episode. Until then, it's goodbye from us.
Thanks, Ava. That's all we have time for from this archived episode today. I hope that you enjoyed it and have found tips and tricks that you can use to implement creativity in medicine and bring some joy to your professional career too. If you enjoyed today's episode, make sure you subscribe to Sharpscratch wherever you get your podcasts, and be back in 2 weeks' time for our next episode from the archives, where we'll be discussing anxiety. And until then, stay sharp. Catch you next time.